Imagine being diagnosed with a disease that was once a death sentence. That's what it was like to be told you had HIV just a few decades ago. But today, that's no longer the case. The fear and uncertainty that come with an HIV diagnosis can be overwhelming. You might wonder, what happens next? How will this affect my life? These are questions we'll answer, but first, let's talk about the breakthrough treatment that's changed everything: antiretroviral therapy, or ART. ART is a combination of medications that work together to stop the HIV virus from multiplying in your body. But here's a common myth: many people believe that ART is a cure for HIV. That's not entirely true. While ART can't cure HIV, it can suppress the virus to the point where it's undetectable in your blood. The truth is, ART is a highly effective treatment that can help you manage HIV and live a long, healthy life. For example, consider someone who's been living with HIV for years and has been taking ART consistently. They've been able to keep their viral load under control, which means the virus is no longer multiplying in their body. So, how does ART stop the virus from multiplying? It's actually quite simple. The medications in ART target different stages of the HIV life cycle, preventing the virus from replicating and spreading to other cells in your body. But for ART to work, it's crucial that you take your medications exactly as prescribed. This is where adherence comes in. Adherence means taking your medications at the same time every day, without missing a dose. It's essential because if you miss even one dose, the virus can start to multiply again, and you may develop resistance to the medications. So, it's vital to stick to your treatment plan and work closely with your healthcare provider to ensure you're taking your medications correctly. Now, let's talk about viral suppression. Viral suppression occurs when the virus is no longer detectable in your blood. This is the ultimate goal of ART, and it's achievable if you take your medications consistently and work with your healthcare provider to monitor your viral load. But what happens if you're consistent with your treatment? If you take your medications as prescribed and maintain a suppressed viral load, you can expect to live a long, healthy life, just like anyone else. You can work, have relationships, and pursue your passions without worrying about the virus controlling your life. But here's the thing: HIV is still a serious disease, and if left untreated, it can lead to serious health problems. That's why it's so important to get tested and start treatment early. Early treatment can make all the difference in managing the disease and preventing long-term health problems. So, if you're living with HIV or know someone who is, it's essential to encourage early treatment and adherence to ART. By doing so, you can restore hope and help people living with HIV lead normal, healthy lives. With ART, people living with HIV can expect to live a long, healthy life, free from the fear of the virus controlling their every move. So, what can you do right now? If you're living with HIV or know someone who is, encourage them to work closely with their healthcare provider to develop a treatment plan that works for them. And if you're not living with HIV, you can still make a difference by supporting those who are and helping to reduce stigma around the disease. In conclusion, HIV is a manageable disease, and with the right treatment and support, people living with HIV can lead normal, healthy lives. So, let's spread the word and encourage everyone to get tested and start treatment early. And if you want to stay up to date on the latest medical knowledge and tips, be sure to follow Easy Medics Daily for clear, life-saving information that can help you and your loved ones live healthier, happier lives. Subscribe now and join our community of people dedicated to making medical knowledge accessible to everyone.